Good morning, Anna. You ready to go?
Good morning. Yep.
Are you on Kauai?
No, I'm still in Oahu.
Oh,
Yeah, I feel bad for the in-laws and their friends. It's been raining the whole time they're here.
well, I had a friend in town too, and she was able to find spaces on the neighbor or everywhere where there was sunshine each day. So that was good.
Good.
Another reason why I'm thankful we switched this to virtual, so we weren't standing out somewhere. All right, we'll be getting ready to go in just a couple of minutes. Please stay muted until the end of the presentation, but feel free to write questions in the chat, and we will monitor those throughout the presentation and hopefully answer them during the presentation. Okay, everybody should be seeing the first page of the PowerPoint. I'll just give it another minute. Please feel free to put questions in the chat, and then when we are done with the presentation, we'll make sure we go over all the questions in the chat, and then people can unmute themselves and ask questions. Good morning, everybody. We'll go ahead and get started in just a few seconds. This is being recorded, so this will be placed onto our website as soon as we can get it up there, hopefully later today, but if not today, early tomorrow. All right. Okay, we're going to go ahead and get started and respect everybody's time. I'm sure there will be people coming and going throughout this presentation. Good morning, everyone. Hope everybody is staying safe and dry. Looks like this afternoon and this evening, we're expecting some of the worst of the storm here on Oahu. So please make sure that your family and yourself are in a safe space that won't be affected by the storm. We will be sending out notifications to all of our providers on the possibility of any evacuation shelters being opened, and we will be monitoring that throughout the day. All right. My name is Laura Thielen, and I'm the Executive Director of Partners in Care. If you're here today, it's the reason you're here is to listen to our point in time community report. And we hopefully will answer any questions that you may have about this report within the allotted time. We intend on being online until about 10 a.m. So please feel free to put your questions in the chat, and following the presentation, we will be allowing people to unmute themselves. But during the presentation, we're going to just go through the entire presentation first and then open it up for questions. If one of my team could please put the actual report into the chat. If you didn't receive it, please take it from the chat And hopefully you did receive it if you're on this call. We sent it out this morning at 8 a.m. As with any report, there are probably going to be a few errors in there, but we have double, triple, and quadrupled our checks on the numbers, and we feel very confident with what we have put into this report. So I'm going to introduce our two leads for this press conference. First is Tanya Brown. She is the current chair of Partners in Care, the continuum of care for Oahu. She is also the executive director of U.S. Vets in Waianae. Tanya will be going through many of the slides, and then we'll also have Anna Pruitt, who has been a great partner with us for many years from the University of Hawaii. She is interim director at the Office for Poverty Research and Action. So we've got some of the best experts in the field presenting this presentation to you today. And I look forward to answering any questions that we may have. And with that, we will move forward, and I will toss it over to Tanya.
Great. Thank you very much, Laura, and welcome everyone. Good morning. I want to start off with talking about the purpose of the point in time count, right? And it is to provide a snapshot on a specific night, offering crucial data on the number of people experiencing homelessness. This count helps in identifying trends and understanding the needs and characteristics of those experiencing homelessness. And I also want to emphasize that the data captured in the point in time count is self-reported. It's very important to make sure that everyone is aware of that. So the point in time count is important because it informs policy decisions that affect the flow of funding to our communities. It also allows communities to track changes and trends in homelessness over time, assessing the impact of current strategies and identifying areas that need improvement. Our data shows that there are 4,494 people experiencing homelessness on the night of January 22nd of this year on Oahu. Of these, 62% or 2,766 individuals were unsheltered, staying on the streets or in other places not meant for human habitation. The remaining 38%, totaling 1,728 individuals, were in emergency shelters, transitional housing, or veteran safe havens. When we compare this to last year's figures, we observe a 12% increase in the overall count. Specifically, there has been a 17% rise in those who are unsheltered and a 4% rise in those who are sheltered. In last year's PIT count, there were 4,028 individuals experiencing homelessness. Looking at trends from 2017 to 2022, we saw a 26% decrease in homelessness. However, since 2022, there was an increase in all populations. The sheltered population has decreased by 50% since 2010, while the unsheltered population has surged by 62%, contributing significantly to the current rise in our total count. So these findings really underscore, right, the urgent need for targeted interventions to address both the immediate shelter needs and long-term solutions to reduce homelessness on Oahu, as we've detailed in the Partners in Care strategic plan. Here you can see the 7 regions on Oahu. I'd like to highlight that the largest concentration of individuals experiencing homelessness is in Region 7, that encompasses the Waianae Coast, with regions 1 and 2 following closely behind. Later in our presentation, we are going to dive a little bit deeper into the specifics for a few of our regions. However, I want to strongly encourage all of you to read the full point in time count report, which will be available on the Partners in Care website and also posted in the chat. But in that report, you're going to find a comprehensive page that details for every single region on Oahu. So this slide presents the total point in time count for Oahu from 2010 to 2024, broken down into sheltered and unsheltered populations. So as you can see, the green line represents the total PIT count, which peaked in 2016 at 4,949 individuals and saw a general decline until 2022, followed with an increase in the past 2 years. The blue line illustrates the sheltered population, which has generally decreased over the years, starting at a little over 2,700 in 2010 and dropping to just over 1,700 in 2024. Notably, though, there was a significant reduction in sheltered individuals between 2016 and 2020, and that is attributed to the decrease in shelters. Conversely, the red line shows the unsheltered population, which has been more volatile. We saw a considerable rise from 1,374 in 2010 to a peak of 2,324 in 2017. After a brief decline, the unsheltered count has increased again, reaching 2,766 this year. It's important to point out that due to COVID, a count of those who were unsheltered did not occur in 2021. So, however, we did capture the count for those who were sheltered. Therefore, you'll see on the blue line a count notated. There is a decrease from 2020 to 2021, and that is attributed to the coordinated effort of getting families housed on the onset of the pandemic. So these trends really highlight the shifting dynamics, right, between sheltered and unsheltered populations and underscore, again, the ongoing challenges that we face. The drive this year is due to the rise in unsheltered.
We have here is a new addition to the point in time count community report. And as many of you know, over the last 4 counts, we have gone with a GIS program application that people used during the point in time count. And this allowed us to geolocate folks and large encampments of folks throughout the island. So when you look at this map, what you're really looking at is it's broken up into the 7 regions. And as a reminder, that is a subjective region map. It's not tied to like council districts or congressional districts. These are what have been established over the years as places where the different providers are providing services. So as you can see in Region 7, which is the Waianae Coast, there is a heavy population of those experiencing homelessness right along the freeway. And then again in Region 1 and Region 2, we see the more white that you see within the graph, the more dense the population of those experiencing homelessness are in that area. And then this pullout right up here from Region 1 and Region 2 really shows where the services are, as well as the majority of individuals for the Region 1 and Region 2.
So this chart here reflects the number of veterans experiencing homelessness. As you can see, there was a steady decline, reaching the lowest count in 2022 at 228. However, over the past 2 years, the numbers has begun to rise. Speaking on behalf of U.S. Vets, the nation's largest nonprofit provider of housing and comprehensive services to veterans, what we are noticing is a shift in the demographics of homeless veterans. They're either older and needing services that allow them to age in place, or they have a much higher acuity level requiring more intensive care and support. On this chart, you can also see our keiki population. There has been a steady decline over the years. What stands out to me, though, in this chart is that the overall decrease is primarily driven by the keiki who are in shelters. Meanwhile, the number of keikis living on the streets or in other places not meant for human habitation has remained steady, as indicated in the red line on the chart. It's a similar trend to that of the veterans, and the past 2 years have shown an increase in keiki experiencing homelessness, unfortunately. I want to make sure that I point out that these statistics reflect the strategic work done with families and veterans, right, over the past several years. We've made a concerted effort to focus on veterans through the mayor's challenge on homelessness. And what that shows us is that whenever there is a focus, impact can be made.
So now we're going to look at some of the demographics of the overall point in time count population. So here you can see that slightly over half of all individuals in the point in time count this year identified as a man or a boy if they were a child. And this is reflective of what we've seen in the past. We tend to see, more men than women. And women tend to be more likely to be sheltered than men. So here, if we look at the age groups, as we've seen in previous years, the largest group is those over 25 years old. What I want to point out, as you just saw in the previous slide, is there's been an increase in children, folks under 18 years old. So we've actually seen a 16% increase from last year. It increased from 559 last year to 647 this year. We've also seen about a 9% increase in those who are over 25. So those are some of the things to point out from this particular slide. So now looking at the race breakdown for the total PIT count population. So the dark green bar is the total PIT population. So that includes both sheltered and unsheltered. And the lavender bar is the population of Oahu. So if we look at the PIT population, we see that the largest percentage of those who were experiencing homelessness back in January were Native Hawaiian or Pacific Islander. So 41% of all PIT individuals identified as Native Hawaiian or Pacific Islander. The second kind of largest racial group would be those who identified with multiple races, making up about 28% of the PIT population. So if we look at, we compare the PIT population race breakdown to the overall population on Oahu, a couple of things stand out. Those who identify as Asian or Asian American, as white, or as Hispanic are underrepresented in the homeless population, while those identifying as Black, African American, or African, Native Hawaiian, or Pacific Islander in multiple races are overrepresented in the homeless population compared to the overall population. So this is something that we've seen for the last few years since we've really been tracking racial disparities. So this is definitely something that we should target in the future. If we just heard, we know that when we target certain populations, change can be made. So this is one area that we might want to focus. And I did want to note that this is race alone. So it doesn't, so multiple people who identify with multiple races are all in that multiple races bar. So it's not accounting for people who identify with multiple races within the other racial categories, but you can see that breakdown in the report. So if you are interested in that, please check the report because we know we have a large population of multiracial folks. Okay, so looking at some of the characteristics of the population, there's a few things that we wanted to point out. First, we know that last year, there was a sharp increase in the percentage of the total PIT population who were 60 years or older. And it was kind of a concerning increase in something that we've been working on addressing. And so this year, we didn't see an increase. We saw a slight decrease, but it still remains about 20% of the overall point in time count population are 60 years or older. So definitely still a concern and an area to focus on. We also wanted to see how many folks were affected by the Maui fires. So 35 adults indicated that they were homeless because of the fires on Maui. So I did want to point out that while this is only 1% of the overall point in time count population, this question was only asked of people who were surveyed in the unsheltered population. So it's about 3% of all unsheltered surveyed adults. Turning to veterans, we see that the percentages stayed about the same as we've seen in the past couple of years. About 10% of adults were veterans. The next kind of percentage there shows that 81% of all of the point in time count individuals were in HMIS. So this indicates that they have been connected to homelessness services at some point in the recent past. So I did want to point out, though, that when we look at the unsheltered population, it's only about 59%. So still more than half. So that's great. But it suggests there's about 40% of folks who have not been connected to homelessness services. And so there's an opportunity there. We also wanted to point out that about 40% of all adults and unaccompanied minors were chronically homeless, meaning that they have been homeless for long periods of time or multiple times for long periods of time and have a disabling condition. So this is an increase from last year. It was 36% last year compared to 40% this year. And this is a trend that we've been seeing. We've been seeing this number and this percentage increasing over the past few years. So something to be aware of for sure. Similar to last year, there were about 8% of adults and unaccompanied minors who identified as a sexual or gender minority. So this includes people who are gender diverse, as well as people who have a sexual orientation other than straight. So last year it was about 9% of the population, this year about 8%. And then finally on this slide, looking at the rates of reported mental illness, about 33% of adults and unaccompanied minors reported a mental illness. And so that's a little bit lower than last year, which was 39%. And what I did want to note is that this shows that, while the majority of people do not report a mental illness, this is a much higher rate than the rates of mental illness that we see in the general population.
Just to add to this, there was a question asking how long people had been homeless. We do not have that currently in our report because we want to do a special focus on that to see where people are coming from or where how long they have been on the island. So that will be coming up shortly.
Okay, thank you, Laura. A couple of other things to note. I won't go through every single number on the slide, but a couple of things to note. The number and the percentage of the overall PITC count who reported having a physical developmental disability has increased from last year. It was 28% or 643 individuals. It increased to 876 people at 36% of the total population. And so I think what we are seeing is, similar to the trend with veterans, we are seeing folks who are who have more, medical fragility, they have more medical needs, and may need additional type of targeted supports. So while we saw those rates increase, we saw the percentage of adults who reported a substance use disorder decrease slightly from 31% to 26%. Another population that we know has been on the rise in the last few years includes the domestic violence survivors. And so we didn't see a huge increase or decrease this year, but it remains about the same as last year at 22% compared to 23% last year. And there's a section in the report that focuses just on domestic violence survivors that shows their characteristics and the ways in which they are kind of unique from other people in the homeless population. So we encourage you to check that out as well. Another thing I wanted to mention is we've started asking about pet ownership because we know that pets can be an important form of emotional support, but can also be a barrier to accessing shelter or housing. So about 20% of the overall point-in-time count population reported having at least one pet. So that's something to keep in mind as we start to kind of consider supports that we want to develop for different populations.
So this chart here provides a detailed breakdown of our sheltered populations categorized by shelter type. That includes emergency shelter, transitional housing, safe haven, and veteran safe havens. So what really catches my attention is the marked decrease in the overall census, particularly in transitional housing. The total available transitional housing beds have dropped by about 30% since 2015. Although emergency shelter beds have remained relatively the same with minimal fluctuations, we've observed a slight increase over the past few years. I think it's also important to emphasize the correlation between the overall total number trend and that of the transitional housing. So this contrasts with what we're observing among the unsheltered population. So I'm thrilled about this map because it details the various shelter locations and types. Partners in Care is expanding this map to encompass service providers across the entire continuum of care. And this expansion is crucial for us being able to coordinate services amongst providers within regions, right? Which would reduce the duplication of efforts, thereby maximizing each service provider's specialty and strengths. I want to mention that, as a COC for Oahu, we're committed to fostering collaboration amongst governing agencies, service providers, and community groups to address homelessness comprehensively. I want to extend an invitation, though, to everybody to visit the partnersincareoahu.org website, because there you will find the latest map and information, because I think, it's pretty safe to say that over the course of time, sometimes locations and resources are going to change. So make sure you visit our website. Again, partnersincareoahu.org.
And I'll just follow that up with the obvious blankness in the west side as well as North Shore. There are not many services in those areas, and so we will be addressing that to make sure that we have support in every community that we possibly can. There also may be things that are missing from this map, and if you are a shelter that's doing it out of a church or out of just a volunteer group, please let us know, because we would like to add any other resources possible so that we can make sure that as many beds are open for individuals as possible.
Yeah, thank you, Laura. So this chart here illustrates the total number of shelter HIC beds compared to the total sheltered count from 2015 to 2024. So HIC beds refers to the total number of available beds across emergency shelters, transitional housing, and safe havens. The total number of available beds has decreased by 30% since 2015, most notably again in transitional housing, which has decreased by 66% from 2,354 beds to 809 between 2015 and 2022. The following year, though, we did see an increase in 196 transitional housing beds and 48 emergency beds, but the total beds have decreased by 5% between 2023 and 2024. So here you'll find an overview of the 7 regions along with their respective areas. Additionally, we're providing data on the number of shelters and individuals experiencing homelessness in each region. Regions 1 and 7 stand out to me with the highest ratio of shelters to homeless population. Region 1 boasting 12 shelters serving 659 individuals. Conversely, Region 7, encompassing the Waianae Coast, faces the challenge rate of highest number of individuals experiencing homelessness with 2 available shelters. I do want to point out that the number of shelters is reflective of registered shelters in HMIS on a particular day, which, to Laura's point in the last slide, it's so very important for folks to get connected to us, partners in care.
So I really like this slide. So I want to point out a couple of things. So while the number of shelter beds has decreased over time, what we see here is that the number of permanent housing beds has increased, right? So I think that's something that's important to note. And what this slide shows is a snapshot of how many people were enrolled in a permanent housing program at the time of the point in time count. So at any time, we have thousands of people who are in these permanent housing programs receiving services. So permanent supportive housing is the kind of lime green line that you see at the top. And this is long-term housing assistance, helping with both paying for rent as well as providing wraparound case management services. It's the most intensive type of program and is generally reserved for those who are chronically homeless and have some sort of disabling condition. And then rapid rehousing is the middle line, the darker green line, and it's more short-term, medium rental assistance, so less intensive. And then the bottom line is other permanent housing. So this is community-based housing with no defined length of stay, things like emergency housing vouchers. So what we see is that permanent supportive housing has been increasing steadily over time from 2015. And rapid rehousing, the number of folks who were in rapid rehousing was increasing up until about 2022, until it decreased sharply in 2023 and remained about the same this year as well. We see that other permanent housing programs started to increase in about 2022, and then a sharp increase in 2024. So one of the things that I really wanted to point out is if you remember the slide at the beginning that showed how the total number of people counted in the point in time count was increasing over time and then peaked in 2017 and then started to decrease in 2018 and then leveled off. That's where you see us have the kind of the largest kind of increase in permanent supportive housing from previous years. And so you really can see the impact that permanent housing has on our numbers. But I think what it suggests as well is that we need a lot more. So I think looking at this slide in relation to some of the previous slides is really useful for understanding the impacts on our system. And this slide shows the percentage of the total point in time count each year that is sheltered and unsheltered. So I think we've already looked at a similar slide, but I think what's interesting to note is that the percentages have basically flip-flopped, right? So in 2015, about 60% of our point in time count population were sheltered, and in 2024, about 60% are unsheltered. And so definitely something that we want to focus on.
So here we have Region 3 covering Eva and Kapolei area. The number of individuals experiencing homelessness has surged by 42% compared to last year. with a total of 420 identified in this year's count, up from 301 from last year. So for those who were surveyed, family issues and substance abuse emerged as the primary cause of their living with homelessness. And a staggering 55% of those surveys were identified as chronically homeless, with 13% of all chronically homeless households in the unsheltered count are located right here in Region 3 of Ancapule. Another revelation, 13% of surveyed adults were veterans. That means 168 veterans, right? Individuals who've served their country are now grappling with homelessness on the very streets that they defended. Additionally, I want to point out the average age of adults surveyed was 47 years old. Here we're continuing on with Region 3 of Ancapule. This chart depicts the percentage of unsheltered individuals from 2010 to 2024. While there was a slight decrease from 2010 to 2012, since then there has been a steady increase, with only 3 instances of the count dipping down in 2015, 2019, and again in 2023. And here is Region 7 covering the Waianae Coast. There is a significant increase in homelessness, up 24% from last year, with 783 individuals experiencing unsheltered homelessness. The primary reported cause was the inability to pay rent and the financial loss. The average age of surveyed adults were 45, totaling 342 individuals. Additionally, 5% of surveyed adults were veterans. 183 individuals surveyed were chronically homeless, comprising of 54%, with a staggering 22 of all chronically homeless households in this region. And as previously seen in Region 3, here is the chart that displays the percentage of unsheltered individuals in Region 7 from 2010 to 2024.
We wanted to investigate. Oh, sorry. Go ahead, Laura.
Go, Anna.
We wanted to investigate potential reasons for some of these increases for some regions and decreases in others. And one theory is that there were folks moving from one region to the other. So we used mapping and GIS to test this theory. And what it showed is that there's actually no evidence that there are individuals moving around all that much. So this map shows the 2024 surveyed individuals' locations, and we compared those to where those individuals were in 2023. And the maximum distance that there was that anyone moved was about a mile. So you can go to the next slide. I can show you kind of 2 examples. So this is an example from Region 7. So you can see the person here with the line drawn between the 2023 and the 2024. This is where the person was in 2023. And then this is where they were counted in 2024. So it's about 0.9 miles away from the location they were surveyed in 2023. And you see a similar example from Region 1 on the right. So what this suggests is that people who are in the unsheltered surveyed count that have been in multiple counts over time are not moving all that much. So there must be some other explanation or additional explanations for why some of these regions are experiencing sharper increases than others. And so that's something that we want to explore next in some of our next steps.
We will be producing a report that looks over multiple years and their movements. So that will be coming out shortly. And there will also be information within the report that states the longevity of people in homelessness. So that was one of the questions that we had. All right. This is our inflow outflow chart. And so in the past, until last year, our point in time count report only reflected the actual point in time count information collected on the night in January that we went out and counted. What we decided to add over last year and this year's report is an inflow outflow of our system over the previous year. So from February 2023 through January 2024. So while we had strong numbers, more than 4,000 individuals experiencing homelessness in 2023 on January 22nd of 2024, this really shows another way of looking at the information. Over the course of that year, we had almost 12,441, or exactly 12,441 individuals that got some type of service from the homeless system during that time. So that could be something as simple as an outreach touch from someone, or it could be that they were enrolled in programs and went through housing or emergency shelter. So this is a number that we really need to focus on next to the point in time count number to really understand what's going on in our system. So what we have here is of those 12,000 plus individuals, non-duplicated, we had 23,740 enrollments. Enrollments refers to the program that a person has become part of. So they can have multiple enrollments. They can have an outreach enrollment, as well as moving into a shelter, as well as moving from region to region and changing their outreach contacts. So this is a very interesting and important thing that we need to follow up on, because while we were only able to count over 4,000 individuals, this is the reality of how many people use our services on an annual basis. And this runs pretty similar from year to year. I think some of the things that are affecting this is that we had an outreach program shut down and wasn't restarted for a little while. And a lot of our agencies are really struggling with capacity. We have a lot of agencies that have open vacancies for employees. So if anybody here has the passion and the willingness to work with an agency that does this type of work, we encourage you to look into our programs and investigate and see if we can get more people into the outreach and into other services on Oahu. So we do this inflow outflow by month. We started doing this a couple of years ago. So here you can see exactly what we're looking at on a regular basis. This dashboard and others are available on our website on a regular basis. And what this really shows is that we had more than 15,000 intakes. So people came and got an intake done by a service provider. And thankfully, we had over 15,000 exits. So hopefully those exits were positive, but we'll go into that a little bit deeper later on in this report. So when we talk about enrollments, we're really talking about what type of projects people are getting services from. And so literal homelessness services such as outreach, assistance with housing, assistance with homeless prevention. We all hope that we can move away from actually housing folks and actually prevent them from becoming homeless in the first place. And then services only usually means outreach and other types of case management that people are taking advantage of. So here on the breakdown, you can see all the additional homeless programs that people have been part of over the last year. And then exit destination. This is really important to see how we are being successful in our programs. As you can see, over 1,700 individuals got placed in permanent housing, some sort of permanent housing. 647 were temporarily housed. So that could possibly be transitional shelters or short-term housing. Unfortunately, the return to homelessness is a big number. We've got over 3,100. We do see people cycling in and out of homelessness. And like many other things in the world, the first time doesn't always work best for the individual. They may not like where they're staying. They may have undiagnosed symptoms that need to be addressed in a better setting, or they just fall out of homelessness for a variety of reasons, whether they're being kicked out by a landlord or the landlord has decided to sell their property. There's lots of reasons for the return to homelessness, just like there's lots of reasons people have fallen into it. And then in our inactive files, we've got almost 2,000. And this is somewhere where we really want to do our best to work with those who are unsheltered, because what this means is that they are no longer getting services and they're no longer enrolled in a program. This might mean that they have self-resolved and they've moved into housing, or it might be that an outreach worker or an outreach team is no longer able to locate the person. So there's a few things like that. And then, of course, people obviously pass away. Our hope is that people, before they can pass away on the streets, they can move into shelter, move into housing, so that their life will be as good as it possibly can be, and they can get the services that they need and hopefully last longer and have a functioning life and enjoy their life and thrive.
So what we aim to do is to leverage the PIT count data to delve deeper into pertinent issues and populations, and presenting these findings in the most practical format for both service providers and policymakers. Additionally, we want to utilize this data to identify repeat individuals experiencing homelessness and connect them to essential services. We will be publishing soon sub-reports that will focus on Native Hawaiians, kupuna, veterans, victims of domestic violence, youth, repeat individuals, and the impact of policies on the inter-regional movement of houseless individuals.
And with that, I would like to end this with a very sincere thank you to the Partners in Care staff who have done a wonderful job of collecting this information, cleaning it over the last several months, and getting it into this format so that we can share this with all of you today. As we stated several times, you can get this information, the full report, on our website. And we will continue to be posting sub-reports as the year goes by. We really want to thank, we had over 350 individuals that came out to assist us in asking these questions and observing people. One of the things that we didn't touch on quite as much because we have in the past is the type of surveys that we do. So the one survey with all the questions is an in-depth conversation with the individual. And then when we find people who are asleep or unwilling to talk to us, or it's an unsafe place for our surveyors to enter, we do an observation tool, which just gives us some of the basics of what we can tell from looking at a person. And that's usually a generality about their race, as well as their age, and if they have children accompanying them. So now we will start with questions in the chat. And then after that, we will open it up to anyone unmuting themselves, but we'll keep people muted until after these questions are asked. So I believe Efren and Mallory will be combing through the chat.
Yes. So Laura, I know you answered this question at the beginning, but just for anyone who joined later on, do we have any data about how long elderly people have been homeless?
No, but that is a great question that we are going to be delving into, knowing how long a person has been homelessness. If they are in the HMIS, which is our homeless management information system, we will be able to pull that information. That was also a question within the questionnaire. So we will also be able to pull that from our surveys on the point in time count. So we will be following up with that.
I will say that given the high percentage of people who are chronically homeless, we can, I think that does suggest that a lot of these folks have been homeless for at least a year or more. So I don't know if that helps answer the question in the meantime while we're kind of running the numbers. So something to keep in mind.
Yeah.
Okay, and I have the
Sorry,
next question.
I'm the one who asked the question. It was specific for ages 60 and plus, not just a general homeless community, but just specifically for 60 and plus group.
It's a great question, Robert. So we, I believe, we are doing a report on Kupuna. So that will be part of that full report. We'll make sure that that question is addressed in that report.
And I did put in the chat, Robert, that of the 253 people in the unsheltered survey count who were Kupuna, 214 had been homeless for a year or more. So it's a pretty high percentage, but we can also look at that for some of the sheltered Kupuna as well.
Great,
All right.
thank you.
Mallory?
Okay, and if we're ready for the next question, it was, do we know how many of Native Hawaiians are either 50% blood quantum or on the DHHL wait list?
Anna, you want to take that?
Yes, so this is in the report on page 21, and there were 555 folks in the unsheltered survey count that identified as Native Hawaiian, and 256 of those reported being eligible for DHHL. So I don't know that we asked, Laura, maybe if we ask that question for the sheltered, but I know we ask it for the unsheltered.
And again, this is self-reported. So it's not a guarantee that people are on the list or not on the list, but their recollection told us how to mark that.
Awesome. Can you talk about why the amount of rapid rehousing resources has decreased so much since 2022?
Josh, I'm not sure if you can answer that. Sorry to put you on the spot, but did we see rapid rehousing programs decrease over the last couple of years? Is that the main reason for it? Or do you see anything else indicated in these findings?
That's exactly right. We've had a handful of rapid rehousing projects close over the past couple of years, including pretty sizable ones like OHN, for example. So losing those rapid rehousing beds is reflected in the data. And that's generally due to funding or folks that are applying for the funding to actually operate rapid rehousing projects.
Thank you.
Hi, sorry, that was me who asked the question. I had a quick follow-up to that.
Sure.
I'm wondering, are you guys looking for more funding? Like, is the funding for rapid rehousing a priority, or would you rather have that funding go to more permanent housing options?
For the last several years, HUD has prioritized permanent supportive housing, and we have also prioritized that in our applications to HUD. We have been notified by HUD that there will be an additional permanent supportive housing resource becoming available soon. So we're anticipating hopefully more beds that will be permanent supportive housing. A lot of what we have also seen is that while rapid rehousing is a very great resource for individuals who are capable of working and to be self-sustaining after a short amount of time between 3 months and a year and a half or 2 years, we've found that a lot of people really need that permanency, that it will be really hard for them to be self-sustaining. And that has proven to be the case, especially with kupuna. Elderly individuals who are experiencing homelessness for the first time, or even those who are chronically homeless, their fixed income has really, stalled them in the ability to be self-sustaining. All right, next question, Mallory or Efren?
Yes. Okay. So the next question in the chat, it wasn't really formatted as a question, but someone mentioned that the exits from the rapid rehousing and PSH to permanent housing is the metric that they're most interested in because it shows the effectiveness of our work. Is there, I guess, can we elaborate on the exits from rapid rehousing and permanent supportive housing?
Yes, I think that's really, it is the most interesting point that I see in this report and just in general when we're reviewing programs that provide permanent supportive housing. We're looking to see if those folks who are on those programs, if they're benefiting, and so making sure that our agencies are doing the best programs possible. Over the last several years, we have had a huge decrease in the number of service providers on the front lines, case managers, outreach workers. We often see people moving to different areas of the homelessness system. And so we're actually doing a lot more training on new people because they're coming in and then leaving very shortly. So we really need to shore up all of the support services that go with that permanent supportive housing resource. And that has been very difficult. We've been working very closely with the health plans as well as with Medicaid to improve on those support services, but we are very far away from having a really robust supportive service programs on Oahu. We need to get more people on board to do that direct service and give them the supports that they need to be successful with those experiencing homelessness.
Great. Laura, I believe this question was in reference to the region movements page. Are there any thoughts of the impact of increased enforcements in areas and how that's affected movements between regions?
Well, great question, and we don't have the answer to that, but that is what we will be reviewing when we look at the movement amongst houseless individuals. There are a few programs that we will be looking at and seeing if that has affected movement, one being the weed and seed area of Chinatown, as well as the sit-lie bans that have been put in place. We'll also be trying to tie some things to see if there's any relationship between sweeps and movements from region to region. Again, what we've seen this year is there's not a huge movement of individuals, but we are going to look at data going back at least 5 or 6 years, hopefully, to see what that movement looks like. We've got an amazing HMIS team and a specialist who really works on those maps. And hopefully that will really give us some information on whether or not those types of programs like Weed and Seed or Sit-Lie, how they affect the homeless population.
Okay, great. And the next question from the chat, is there any data on whether or not any individuals moved here within the recent past? For example, the last year or two?
I believe that is, Josh, are you able to tell us that?
Yeah, so in HMIS, there is an unrequired intake question for anybody who's enrolling clients into the system. And that is a question on how many years have you lived in Hawaii? If it's less than a year, how long have you been here? That's an optional question, so folks are not necessarily required to answer that. It's also self-reported. So anybody that's in HMIS, we can see some data on that. Right now, it's not attached to the clients that are in the point in time count report. But that's definitely something we would be happy to provide to folks in the future.
Thank you.
The next question is regarding Kapuna. The number increased by 27% in the last point in time count report. Has it increased further / can you go into more depth of the data? Would you have information on their needs? It's important to see what is needed in terms of supportive housing and what types of services should be increased to serve them.
Great question. We're having definitely an increase in people asking for assistance for the first time who are Kapuna. We have been working with the Adult Mental Health Division as well as Elderly Affairs at the city. The Elderly Affairs, we worked with them on and their Section 8 program at the city and county level during our emergency housing voucher program. And they prioritize Kapuna in those 312 vouchers that we provided and worked with. For many of our Kapuna, what we're seeing is their connection to healthcare. And during COVID, we were able to switch a lot of healthcare into telehealth. Our seniors are not as adept at those kind of devices, so there has been some cutoff of services to those who are experiencing homelessness or were precariously housed. And the big thing with those who are experiencing homelessness and are Kapuna is they may have some physical ailments, mental health ailments, but now we are seeing some of the age-related ailments that are adding to their issues. We have recently begun working with care home operators and foster care homes in the hopes that we can get some of these higher utilization people who are possibly seniors into that type of a setting, which may be the most supportive for them. So because of those aging issues such as falling and not taking medication, things like that.
Great. Have you interviewed / surveyed those providing housing and those who are exiting and reasons why? Any analysis / recommendations on how to increase / keep the housing available for homeless or at risk of homelessness?
That's a great question. So yes, I mean, one of the most important things that Partners in Care puts out in our community is making sure that we have connections with landlords who are willing to provide housing for our clients and participants. Over the last 5 years, our landlord engagement program has really gotten a robust list of landlords who are willing to work with us, as well as landlords who actually talk to us before they purchase property in the hopes that we will be able to send people to their new housing developments that are affordable. So there's really a real concerted effort to make sure that landlords are our partners, not just a housing entity without a face. And that's really important. We have developed a database of available units that have been identified as landlords who will provide housing for our individuals. So that's really, really wonderful. We hope that sooner than later we can actually use that database across the system, and case managers can take advantage of that without necessarily having to go through the landlord engagement program. So that will be a resource that really helps case managers figure out, okay, my participant really wants to live in this area because that's where all their doctors are, or their support system, or their family members. Then the more we can get those units into our database and give people options, the more likely they'll take those options and remain housed.
Okay. The next question also regarding Kapuna, popular topic today. For Kapuna, it is majority a rent affordability issue. How can PIC work on deeply affordable rents for Kapuna?
Yeah, I'm going to take a wild leap and say that's from Betty Lou, or somebody who thinks like Betty Lou from Catholic Charities, who's always looking at the kapuna. Yes, it seems like, and we're going to be studying this a little bit more in our sub-report, that the majority of those falling into homelessness who are elderly for the first time, it's a resource question, that they do not have enough income to meet the rental demands. I think, I won't talk for the neighbor islands, but I also know because of the wildfires, the rents have exponentially gone up. I foresee that happening here as well, not necessarily in relationship to the Maui wildfires, but just in general, the cost of rentals are going up substantially on a regular basis because people are willing to pay for those. And so those programs that are at the 60% or lower of AMI, the average median income, are losing out because those units are disappearing.
Great. Is there any more detailed information on why unsheltered individuals are remaining unsheltered?
I think, we have a vacancy grid on our website that is updated every single day. And when you look at the numbers right now over the last several months, we've been hovering around only about 10 to 12 beds available on any given day. So that in itself is a concerning situation. For some agencies, they may have more beds, but they may not have the staff to support bringing in more people. But also just in general, there are not enough beds for those experiencing homelessness. So that's the primary reason that unsheltered are continuing to be unsheltered. The other big thing, and you can definitely see this on the West Coast, the West Side, you've got people who are connected to that community. And so while we always say that housing is healthcare, and I truly believe it is, community is also healthcare. So if you are in a community that you are familiar with and you've got support networks available to you, those people are wanting to stay in those areas. So when we don't have resources in different areas, it really affects individuals who are unsheltered. I've known of several clients who they stay close to their extended families, but for a variety of reasons, they cannot stay with them. That may be because they're in public housing and they're only allotted a certain number of people, or there may be some family conflict, or there's 10 million other reasons. But people really have chosen their community, chosen where they are remaining homeless. And so we need to look at that whenever we are looking at placing someone in housing. Those considerations are always taken into account, because if we can get them somewhere where they actually want to be, there's more likelihood that they will stay there.
The next question is does the Elderly Affairs have a representative attending the PIC meetings?
We do have representatives from the Department of Community Services and various other people from the city and county. We do reach out to Elderly Affairs quite a bit, but Elderly Affairs encompasses more than just those who are experiencing homelessness. But everyone is welcome to our meetings, and we do have good representation from the city in general. And the more we can get involved, the better. We find out resources that are there that a lot of people haven't found out about it. We also have been contacted by the Elderly Affairs Office, questioning us on what we do and what our different partners do and how they can make good referrals for people who are calling them for assistance. So we definitely have a relationship with the Elderly Affairs Department, as well as many other departments at both the city and the state level.
In the 2023 report, there was a statement on the Native Hawaiian percentage of those who race identified. It stated, when considering only individuals with known race, this percentage rises to 37% at the point in time count. Is that same information included in the 2024 report?
Anna, I'm going to turn to you and see if that is in there.
Yeah, I actually answered that in the chat. I can't remember. I don't think it's in there, but what we can definitely provide that to you. So if you send an email to the HMIS team, get that number to you. Also, what we didn't mention, I probably should have mentioned, is that we are planning to release data tables in an Excel form so that folks can kind of see what the raw numbers are for all of these kind of different questions that we ask. And you'll be able to see how many, how many missing data points there are and things like that. So hopefully that will make it easier for other people who are doing their own research to get their questions answered.
Thank you, Anna.
There is more youth being serviced than was reported. Does PIC have any thoughts or ideas about the reason for that?
I think the biggest reason we have is that not everybody inputs information into our HMIS database. And so that is something that we are working with all of our individual agencies to do, but also even the private volunteer outreach programs that are in existence. Yes, I mean, we actually meet with, through our data committee, as well as our CES, our coordinated entry system, we meet with providers on a daily basis to improve that. We have improved our duplication numbers. And by improve, I mean they've gone down. So we have fewer and fewer duplication of individuals within our HMIS. But yes, we are constantly requesting that people input information into the HMIS database, because without data, we can't answer a lot of these questions. So other than, we do look at all the contracts that people have and the understanding for city and state, as well as federally funded programs. They are all required to input into the HMIS. And I've always told people, if it's not in the HMIS, then according to us who look at that data, it didn't happen. So the more people that understand that their input is important and essential for us to tackle this really hard issue of homelessness.
Continuing on with the youth count, are there plans to have additional counts at different times of days, or a way to count couch surfing youth, / trying to come up with a better system for counting youth since they have different needs than adults?
They have different needs than adults, and they live differently than some of those folks who are adults that have been homeless for many years. Couch surfing is not considered homeless under the HUD definition. So if we come across someone during our point in time count who says that they were staying on a couch of somebody's the night in question, they are not considered homeless. We don't necessarily agree with that. We want to make some adjustments to that definition, but that is a HUD and a congressional ask that we have been asking for many years, because I think for youth specifically, it does not, our numbers do not represent what is actually going on. We also have a difference of definition between HUD and the Department of Education. So the Department of Education actually has a broader definition of homelessness, which includes couch surfing. So, we have been working closely with them to collect some numbers, but those numbers cannot be included in our counts to HUD.
Thank you. Okay, the disability self-report is up substantially. Do we have foster homes and SNFs willing to collab, or how do we prepare for all those who cannot do ADLs?
Yes, This has been a big worry of a lot of agencies. They've seen people go into housing and not get enough of the support services, or the person is not able to do their daily living things such as going to the restroom, feeding themselves, cooking, what have you. We work really closely with the health plans to get those services in place, but it is not until a person is housed that those services can be requested. So there is a big gap there that we are working with Medicaid and with the health plans to try and get to a point where everything is set up even before a person goes into housing. In regards to the care homes and foster homes, we are talking very closely with them. We have been told that there are a number of beds that we would be able to utilize, but along with getting some beds in those care homes and foster homes, we need to recognize that those operators need substantially more money to actually accommodate these types of participants, and that they need the training as well. There has been significant talk at the legislature to get increases in the fee for services that the care homes are asking for. It's also very important that our healthcare system, including our hospitals, are making appropriate discharge plans, which we are working very closely with Queens right now on that, to make sure that any discharge, hopefully will not go back to the streets, and hopefully will go into housing that is appropriate for those individuals. And many of those are care home level care needs.
And Laura, you kind of touched on this question when answering that last question, but has the number of care homes / foster homes decreased over the years? So are there fewer beds? And then how many beds are actually open to Medicaid versus private pay clients who must pay much more?
Yes, so I'm not an expert on the care homes. We're learning more and more as the weeks go by about their needs and their programs and how they're working. So I don't have all those answers. I don't know the number of care homes that have come across, but I do know that in discussions with the providers, with several of their leads, we did discuss that they can take in, one Medicaid and one individual who is self-paying or something along those lines. So there is the ability to use Medicaid for those purposes. And the idea is that they do not refuse someone who is referred that is on Medicaid. But we need to do a lot more education because this hasn't been a resource that the homeless system has really been a part of over the years. But now I think they have told us that they have multiple, like a couple hundred beds available. But we still have to work through some of those details to figure out who are the best people to go into those care homes. And we'll see what happens, but we are working on that as we speak.
Okay. In regards to individuals returning to homelessness, is there more data to be provided on those numbers?
Yeah, so we have a very expansive reasoning for people who return to homelessness. We don't always get those answers, but we have the ability to collect that information. We will be working on that a little bit harder over the next couple of years to get that information as solid as possible, because I think that's while there is the expectation that people may fall out of housing multiple times before kind of it sticks, we understand that there's a lot of movement. There's a lot of trauma that goes into a person's world when they're moving from unsheltered to sheltered. Sleeping in a bed for somebody who has been homeless for a number of years can be very traumatic. And we need to pay attention to those kinds of things and make sure those support services are there as soon as possible so that that person can adjust in a healthy way to living indoors. And so that requires a lot of support services, case managers that are going out to visit on a regular basis and not just meet with a client, but actually see their living space so that we can adjust and make any accommodations that we need to make to get them in a better space in their new homes.
Awesome. I believe that that is all that we have for questions that were in the chat. So
So if anybody would like to come off mute, just raise your hand and we'll call you out. Yeah, we've gone a little bit over time, but this is recorded, so you will have access to this recording.
Laura, this is Danny. I just want to take the time to give you guys a ton of credit. It's I know you touched on it briefly, and I think we see it everywhere in the sphere of people who are trying to do the work in this area, is that it's hard to recruit and retain people who are, I think, dedicated, competent, and the team that you continue to kind of build and maintain have been just amazing. So I think it's worth just, having to, the data probably didn't bear out as kind of what we wanted, but it's part reality and we kind of felt it. But, thank you. And thank you, Anna, for just continuing to support the data and the leadership team. I think it's just a lot of work to be done still, but, yeah.
Well,
that's it.
thank you, Dr. Danny. I see Senator Morawaki.
Hi, aloha. Thank you so much for the session and the information you're gathering. I'm always concerned with seeing that services, especially supportive services, are available. And I appreciate this time hearing more about what kinds of, especially the diminishing services, and where are the gaps in the PUCA, so that, as we go forward, we start to see why and how and what we can do about it, because we can't really house them unless we have housing. So
Yeah.
Even the transitional as well as the permanent, I'm glad to see there's increase in the permanent, but the transitional, where we can phase them into permanent, is really helpful to have. So appreciate getting some of that information and maybe more of why they've left, especially the temporary shelters. Why have they left, or temporary housing?
Yeah, well, for some of the housing that was created during COVID, those programs have just ended. I will say that thank you to the legislature, there was a 5% increase to the Department of Human Services. Unfortunately, that gets us nowhere close to where we need to be, and we know that the legislature understands that. This year, the focus was really on Maui, as it should be. We're looking at 20% being, just the tip of the iceberg to get us where we need to be. I think also, we need to recognize that the salaries within contracts at the state and at the federal level need to be increased. Those contracts have not changed for multiple years, up to 10, 15 years. So we do need to address that as a community, because we do not want to see more money going just for the services and not be able to pay a true living wage for our own employees. So I really do thank the legislature for considering those options and hopefully moving us forward on that.
So the good thing is that we did increase the fee reimbursements. And again, having data are really important. I think the data that you have at a point in time is helpful to know what the needs are out there, but we also need to know what are the services that are missing. And as you point out, if it is the salaries that people are leaving the field, then we should know that, and having data on that as well is helpful for us to know that's a cause. And so we need to address it next session.
Yeah, that's wonderful. I'm glad you brought that up. Over the last summer and more recently, we have a strategic plan in place for Partners in Care for all of our members. And one of the highlighted priorities is better and more outreach and increase in wages. And I think we have been mandated by our COC to get together and do a study on wages within the system. And we're hoping to get that done before the end of the year, which will allow us to get it to the legislature next session to really show what the wages are across the board in this system and figure out, can we move those wages up? And also, can we make sure that agencies have an administrative cost associated with their budgets that will actually pay for all of those resources, because we do know that at the state level, it's some programs are actually being requested to decrease some of their admin costs, and that's very difficult. So I know they're working very tirelessly to make sure that agencies are getting what they need, but there's still a long way to go.
Well, I think data, as you pointed out at the beginning of the meeting, data are really important. So the more
Yep.
data we have, I think it justifies where we
Yeah.
put our resources. And this year was tough with Lahaina, but
Yeah.
we were able to spread it out for especially the areas of great need. So I think we're very attuned to helping
Yeah.
where it needs to be.
Thank you. Thank you for coming today too. Anyone else with questions? Okay, so just so you know, these will be available on our website. If you notice anything that looks out of place, please don't hesitate to let us know. Although we've looked at this report 10,000 times in the last 24 hours, we know we'll miss things. I want to say a special thank you to Tanya Brown, our COC chair, who has been in her position since January and done an amazing job in leading us. Also Anna Pruitt for her brain and everything else, and her passion for this to really help us get this report where it needs to be. And a special thank you to all of our staff who have tirelessly worked on this. We have submitted our reports to HUD. So hopefully this will assist us in getting funding moving forward. We invite anyone to come to our meetings. If they are open to anyone, you can be on our listserv and hear about different events that we're planning and discussions that we're going to be having. Coming up next week, we will be meeting with the executive director of the National Alliance to End Homelessness, as well as the Law Center. And they will be reviewing with us the grants past court case that is currently before the Supreme Court. They will be helping to educate us on what that means for Hawaii in the coming years regarding the issue of homelessness and the criminalization of those actions. So we're hopefully going to get some good word on that and be able to work with our partners to make sure that all of our neighbors who are living on the streets are safe and that they go into housing. With that, I will close out and say thank you to all of you who have attended. We're fighting a good fight here and we have to move forward, and we'll be doing that every day. And a special shout out to all those agencies that are doing the work, even though it is really, really hard. Aloha, and thank you all for attending today.
Aloha.
Thank you.
Thank you.
Bye-bye. Take good care, all.